Diane's on my list.
Yeah. We all
I was
have each
telling you to be
other.
helpful.
Welcome back to the Vermont House Appropriations Committee. We are getting back started again. It is still Wednesday, January 24th, 2024. We had a little bit of a tea break and a little bit, many conversations that happened in the hall. I need like a scribe to keep up with some of the really, really good stuff. I heard coming in, you were gonna hear the budget buddies list went out. Somebody got a hold of me that they were a new member that switched. I hope we should probably look at it again and make sure that we're all got somebody. There was a new member who wasn't on there because there was,
Came in late.
came in late and she's like, oh,
think I might have
I have a budget buddy or should I have? Oh my God, we've got an orphaned budget buddy out there.
They feel slighted.
No, they said, should I go to the person who they would replace on the list? And I said, that would be probably a really good place to start. So, all right. I think
You can do it
Representative
now or you can
Harris,
do it after.
why don't we do it now? Because we're gonna probably take these guys right to their 11 and the commissioner needs to go.
Okay. So real quickly, we have two new reports that are posted on our website. One is nursing home occupancy, and I think it's from Dale and Diva, so I have forwarded it to Representative Page and Representative Dolan. And then the other one was a health health workforce incentive report. And I have forwarded that to Representative Tolino. I don't know if anybody else should be getting it. It's on nursing stuff. It's on our website.
Holland? Holland? On nursing incentives,
I'm sorry.
nursing incentives, educational nursing incentives.
Okay, that works. Okay, that's all I have for now, right, Aaron?
Thank you. I love the nursing home one. Is a really good, that's a good. Okay, so Commissioner and Deputy Commissioner, we left off on page 15, about 75 or 80% of the way down. We're on to transfer and reserves,
That's right.
and then on to one times.
Yeah, so I'll pick up on the transfers section. At the bottom of the page, these are transfers and reserves, either to or from the general fund that are either required by statute or session law, or what I'm categorizing here as deficit mitigation. So these aren't really policy related items. These are either items dictated by law or they're related to refilling special fund deficits. Some of the usual suspects here that you may recognize, including the Fire Prevention Fund and the E911 Fund. I need to focus the most, I think, on probably the top two lines here. The first one, which is an somewhat unusual item that requires explanation, is this transfer from the Cannabis Regulation Fund to the general fund. So if we go back, we have to go back to, I believe it's Act 185 of 2022, which inserted some rather complicated language to change how cannabis revenue would be handled for a period of a couple of years. Originally, the cannabis excise tax revenue was supposed to be a general fund source of revenue, and it would roll right to the general fund, and then 30% would be subsequently appropriated for prevention purposes. But the original plan was for that excise tax revenue to roll right into the general fund, and it would be included in the top level sources, the economist's general fund forecast. It is not included in the FY25 economist's forecast because of this session law change that dictated that in FY25, all of the excise tax revenue, instead of going to the general fund, would go to the Cannabis Regulation Fund, which is the fund where license fee revenue goes. And originally, in the original architecture of the Cannabis Control Board, I think the intent was that the operating costs of the department would be funded out of the regulation fund, which is the revenue source being fee revenue, whether it's growers or cultivators, but that fiat revenue is much less than the operating costs of the board.
Length and money to get started.
So what's happening in 25 is the session law states that all the excise tax revenue will just automatically go to the regulation fund. And then at the end of, and that was for FY 24 and FY 25. So this is, so it won't be until the end of FY 24 that then the session law dictates the Commissioner of Finance and Management, which will be Adam, or if he's on vacation, it'll be me, needs to take a look at what the actual expenditures and balance have been and what the unobligated balance remaining in the cannabis regulation fund is. And then subsequent to the close of subsequent to the closing of FY 24, we'll then make a transfer sometime during FY 25 by a certain date of that unobligated balance to the general
Right
fund.
about now, I'm needing a flow chart. Now I'm.
Exactly.
That's all I. Yes.
So that's why this one,
This is her budget. She knows it.
and that's why this one is a weird one. And as Adam mentioned, it could sort of be considered as in the sources column at the top with revenue and direct applications, although it's different than the other direct applications because those are actually current year revenue. That's what's being forecast in that year. This is actually a transfer of revenue from 24, but the transfer is happening in 25. So anyway, this thing is, it takes me a flow chart as well to step through it. On the operating statement, it's categorized in this section of transfers down below, and it's not categorized in our operating statement, which is also included in this package as a revenue source at the top. And we wanted the numbers to tie out to the operating statement. And I've explained a little bit of our rationale for this appearing in the transfers section, but you could also think of this as being revenue, except.
Well, I'm glad we took a break before that.
Exactly. And presumably, the last thing I'd like to say about this is presumably, according to that Act 185 language, things are supposed to go back to normal in 26, and the revenue would just flow to the general fund. But I just wanted to kind of alert the committee to the fact that something that's going to need to be figured out, I think, about what to do with revenue for Cannabis Control Board, because their expenses so greatly exceed the Cannabis Regulation Fund fee revenue that something there.
So we're talking fees then to keep up with the situation.
And yes, as we've talked about that. So I remember when this was put in place, and I couldn't recite it as well as you did, but the goal was to ensure that the special fund wasn't in the red. So it was a way of funding it as they're standing up the program. I know they're getting a lot of money in now to the tune of about 1.6 million a month.
Right.
To fill this out. So the idea is to keep that whole and then transfer the remaining. And ultimately, the idea is that we reach a point where even if it all goes to the general fund, 10 million of that, it's a different 10 million, will go into prevention. It's 30% up to a maximum of 10 million. So some people may have heard the 10 million, that's a different 10 million than the 10 million.
That's correct. So glad you brought that up. So the assumptions in the governor's budget are that at the end of FY 24, when all the dust settles and we're picking up the pieces in closeout in July, we anticipate there will be $10 million left over to transfer to the general fund in FY 25.
Right.
And this is where it appears. We are also including in the DMH budget an appropriation of $3 million,
$3 million.
which represents 30% of the anticipated transfer.
Right.
So when you get into the weeds in DMH, you'll see a $3 million base appropriation there.
And someday, if we ever have enough revenue, it could be up to 10 million, which would be 30% of 30 million coming into the general fund.
And I'll admit, I was glad that we could justify a round number like 10 million, It makes it slightly easier to explain and understand and also tie back to that $3 million number in VMH.
And I've spoken to the chair of Ways and Means, and not this year, but in last year, regarding the way it's been set up so that 100% of the excise tax goes to the general fund. And we do want to keep the special fund whole. And if we need to make small adjustments down the road, you know, it's still too early to tell. It may be fine, it may not be, and there may need to be some tweaks to those percentages, but you know, this sounds like it's,
I think you'll find you have, to Hardy's point, you have it one way or the other, you have a structural problem.
Yeah.
That you're going to have to solve because the fee revenue is supposed to support the control board.
Right.
And they have taken steps specifically to limit fee revenue, not limit per se, but to lower fees for various growers to encourage small businesses and minority
yeah,
growers.
the illicit market and those.
So you've got some structural issues you'll have to deal with.
That's
there.
right.
But I think I would be encouraged based on recent revenue flows that, you know, the money will be there. You just have to allocate it.
Figure out the right allocation. And that's what we're talking about is it's just too early to tell at this point, but at least the revenue is going in the direction that we were hoping it would go in.
So I'm sure this will be through investigation. But my concern would be to circle that the realization of that $10 million is really based on a lot of things that need to happen. And what's the risk of it not being there?
We're tracking pretty well in terms of, in fact, I think the cannabis revenue is even doing better than when we put this together, you know, originally a couple of months ago. So what we are doing is taking the $10 million is based on a projection of FY 24 cannabis excise tax revenue, and then we're subtracting from that the operating costs. Now, I will say, in reading the notes of what's happening in BAA and committee, that they're getting a couple positions or something like that. Well, that's going to come off the top of that 10 million.
Yeah.
If you, any more you give them, that was in the governor's BAA is going to change this number. So keep that in mind.
That is good to know because that's now going to be over next year.
All right, moving on. Okay, so moving on. The next line is a $10.688 million transfer to the capital infrastructure fund, which is the cash fund for capital infrastructure. So this is based on that statutory 4% of prior year appropriation formula, and then you subtract the debt service and what's left over. That's how we calculated this.
How much money that would be spent of general fund that we won't be needing to bond for.
That's right. This would transfer to that fund. If we make this transfer, then that will fund capital projects that otherwise would have been bonded for. Yep. And then the remaining items really are straightforward. They're transfers to the specified funds to offset anticipated fund deficits. And then there are the last two lines, which are the budget stabilization reserve, which again, this does assume that we're converting the appropriation in FY 24 for debt service to a transfer. Otherwise, this would have been $3.5 million higher. And then there's the 2753 reserve, which is just based on, it is what it is. And that's based on our 2753 report to JFC earlier this fall. And then we get to the bottom line and the total uses ties out to total sources. And with that, it's always somewhat amazing to find that's the outcome. Any other questions on the transfer section before I turn it over to Commissioner Gresham?
Thank you for the preview and then we'll start with Representative Harrison.
I don't see it quickly in the one time, so I didn't know if it should have been a transfer part. The AG settlement on the AB5.
Yes.
It was $9.5 million in the BAA. I thought that was like a 3-year payout. So
Shouldn't there be some?
is there something in fiscal year 25 or does it not need to be in 25?
Be 3 years of it. This would be year 2. 3 years, but
I know, but we did the 9.5 million in
Right,
this current year.
right. So we should have
Right.
something for next fiscal
Well,
year.
that's what I'm thinking,
Yeah.
but maybe I'm missing something.
Or did we pay it?
We did not include that in our bill. In part, we were kind of waiting for what the AG needed. And I guess the communication between what they needed was not made.
And my understanding is there's also some variability to the out year payments depending on whether
Sure.
claimants receive green cards or something along those lines. So there is, that's a more,
Not calculated
that's a
yet.
more to come.
No, that's fine. It's just potentially, I don't know, what, 4 million or something, maybe Representative Squirrel know.
Yeah, I have a couple page narrative from the AG's office about this. And right now they're showing, at least on the table, that there's no payment in year 2.
Oh, okay.
In year 3.
It says there's a payment required, but no legislative appropriation. So I need to figure that out,
Oh,
okay?
we may have to do a payment.
Yes,
They can do it through
but there's not asking for an appropriation, according to Scott. So let me follow
an
that.
insurance payment.
Thank you for confirming that our assumption in the governor's budget is at least correct that an appropriation is not envisioned, so.
Good catch.
Madam Chair, the very last part of what we wanted to bring to your attention is actually on page 16. You'll note that we had reviewed, there's a line that says one-time amounts. There was a total of $56 million that was for one-time uses, of which 54.3 was denoted as one-time general fund appropriations in B 1100. Those are all listed on page 16. The list starts with the FEMA flood hazard mitigation matching funds. And I would use the term down payment on that. Our hope is to find another 12.5 million for a total of 25 to unlock what will be about $100 million FEMA award. But this importantly is to help with the very types of projects that communities are trying to carry out to mitigate future damage from natural disasters.
We have had fabulous testimony from Douglas Farnham and his multiple hats titles that I'm not there, between ARPA and FEMA, that he spelled out. And I know that this particular piece, the hazard mitigation piece he talked about, that it's not due until January. So that's good because of the fiscal year 25. And that, you're right, it's about 20 million was the match on that.
Right.
And not that it's yours, but there's also the question of something that there was a waiver that they were seeking on the community, something grants that was also would potentially have a big number to it, but just unknown at this point. We don't know if we got it. We'll talk with him about that. This is not unheard of. We'll work with Mr. Farnham on understanding this. Okay.
The next is a small appropriation to confirm our support for the Vermont sub group every year. They also raise private funds, but we always try to provide some support. There's $350,000 for a renewable energy reform report that the Public Service Department would be very happy to speak to you about. I think, as was mentioned earlier, there's $1 million for the youth psychiatric inpatient facility startup cost. That is the Southwestern Vermont Medical Center. This is not the build out. It's just the, providing the various, essentially gearing up to open, something that we're very anxious to do. There is a one-time payment to essentially confirm that we're following along with the Centers for Medicaid and Medicare, or Medicare and Medicaid, on their new AHEAD initiative. And that's grossed up to a $9 million amount. There's some global federal money too. So global commitment, that's a $9 million amount. That's the general fund portion of it. And the AHEAD program basically is moving another step away from the fee for service into a global payment. This actually is a payment for kind of what I would call the tail of the existing fee for service contract that we have. So we're going to be, actually, I think we may have both even signed it starting Jan 1, moving into a global payment program, but we still have claims that we anticipate from the existing program that we have going, which is more fee for service. So this 9 million will pay out. Essentially, we're kind of double booked for the first year of this. We're paying a tail of payments for people who were in the old fee for service. And then yet we're also entering into a new contract for global that will be made. So this is really just paying out those
we'll get more
expenses that are existing out there.
Healthcare.
Also,
Healthcare dies.
Keep in mind that this is just for one hospital that has opted into this global payment system, UVM Medicals.
Which one?
UVM Medicals. So the thought is that other hospitals, when observing good things this is doing, will join it.
Representative Dickinson.
Can you clarify that January 1st of 24 or January 1st of 25?
24.
Right now.
Moving on, there's the largest single source of use of one time is for the general assistance emergency housing. This is for FY25. And this is to supplement the base appropriation of a little over 7 million in general assistance.
Representative Harrison.
You had some increase in base, right?
Last year, yes.
This year, and did I?
He said 7.
So that, well, for emergency housing, it's a little over 7 million, but the total general assistance appropriation, I believe, is 10.8 for this year.
Oh, that's.
For this current year.
That's correct.
So going into fiscal year 95, you start with that. And then you added, I thought, to base on the previous page, or did I?
We have an additional base for
Operation.
shelter beds, statewide operational costs, yes.
And then you're
This
adding,
one time is just to operate what we anticipate will be the expenses for the general assistance program, hotel, motel, and emergency housing. This is to supplement the base appropriation in DCF's base budget.
yeah, no, I was just trying to add the
21.
different components together for this area. You got 16, you got 10.7, you got.
And then in the BAA, we have another 8.2.
Yeah, but that's this year.
That's to finish out FY24. That's correct.
We're pushing over 30 for next fiscal year.
That would be.
Okay.
Joint Fiscal Committee heard from, I think it was, sorry, we were sitting in these seats, so it's what I'm remembering, sitting there, that he anticipated that at the pace that we were on, which is what it's between 50 and 70 million a year. Right now, the 15, I just did math on the week. If we continued as we are, which we're not, it would run, just the hotel rooms would run 72 million a year. And I mean, I remembered that when it was unheard of, when we were at 3 million, we thought, so the situation out there is that intense. Okay, so.
The next appropriation you see.
Go.
So again, so the 16.5
It's just straight up.
is to operate the existing hotel, motel, and shelter program, right?
That's correct.
And by
The
operate,
statute, what's in statute?
yeah, so does it pay motel rooms?
It is intended to, pay motel rooms.
Right.
And emergency assistance that we
Right.
provided all along.
All right.
hotel rooms, shelters, service, it's the whole package. The more shelter spaces we have, like Waterbury, will help reduce hotel space.
Right.
The more shelters that we build out with that 4, it'll reduce, right? Unfortunately, we watch that happen, but at the same time, it's like digging in a sand pit. We're turning away 60 families a day now. So, that's the hard part is, as much work as we do and we build the units and we do this and we move things, which has all been great work. The situation is, still not in a contained way. That's right. All right. Thank you for putting it in there.
There's another $1 million right below, and those are, some of the people that are operating a program, limited service. We thought it would be sporting to provide staffing. So that is salary benefit and operating costs for those, for that staffing at DCF. Below that is what we've had.
This is Representative Page with a question.
Well, it was just, I think you already answered it, Commissioner, regarding the services for those hotels, motels,
Okay.
mental health, I guess, that sort of thing.
And then I think you've
I'll just say
seen,
this on like the best case scenario is like, all right, we've done some work and some adjustment in BAA that's going over this is the end of the, that things can start to see this line go the other direction. Not because we don't want to do it, but because it's not needed. And that's the moment we'll all go out the hall and cheer.
we're working to bend the curve. if that's-
Exactly. We're working to bend the curve. Thank you, sir. All right.
You've seen Vermont State University bridge funding in past budgets. So $5 million. This is to help in their transformation to a one university sustainable future. Years ago, they came to us and said they need some bridge funding to get there. So this is our contribution this year.
0-4.
3 or 4, I guess it would be year 4 out of 5.
The 5.
And then the right below it also to be TSU, this is the tuition advantage funding, which has been, goes to Community College of Vermont. And it has been just very, well, it's been popular,
Popular.
Imagine.
Representative Mahali, did you have a question?
Yeah, so is the 5 million, it's been 5 million every year.
Actually, it's been more.
It's gone down.
Yeah.
This is lower, right?
That's correct.
But it's not, there's no inflation factor. It's just there's an agreement.
Yeah.
As to how much it would be every year. Okay.
And to be transparent, their ask was 10 million, which was originally the amount that they thought they would need. And in a different world, we may have put in 10 million. We have more limited resources this year. There was also ARPA money that was used. Okay, so we've.
So would I be safe in saying that this is the 5 million that we agreed to pay in each year up to 5, and then if there was, they might have asked for more, but we weren't
I
able
think
to.
there was more.
I think that there, under a schedule that had laid out with the legislature, there was kind of step down bridge funding. I think this year I went down to say $2. And we kind of did our best to meet that. Under other different revenue scenario, without, for example, $29 million of upgrade, that number would probably have been lower.
Representative Dickinson.
Yes, just want to explain, this is the 5-year, part of the 5-year, $5 million to save 20 for the structural deficit. It is part of its transformation, but it's also the whole structural deficit, trying to figure out how we can go and make it more sustainable financially across the board. And it started at, I don't know, 20 million or something in that neighborhood, went down to something else. This year, the current one we're in, I think 16 was in the number, but we only asked for 9 million. So we asked for less because of the ARPA money and other things. But the last 2 years were for 10 million for 25 and 9 million for 26. And then it goes away. And theoretically, at that point, we are balanced with no deficits.
You guys will keep a good eye on it.
We'll
ferret this out.
ferret this out. The tuition advantage, is that a program I'm unfamiliar with? Or is that remember you guys
think it's
asked for
both.
10 for CCV, we ended up giving directly to CCV as opposed to, what's it called? The
The VSEC, the 802 opportunity.
802 opportunity, we gave 4. Is this one that, what is it?
So I believe, isn't this 50% off community college tuition?
Yeah.
So this offers a 50%,
This is the
up to
50%.
50%, I think they call it,
Okay,
income qualified,
yeah.
reduction on.
Income qualified, okay.
So, the next item is a bit of always a tongue twister for me, so I'm actually going to read what WRDA, Water Resources Development. This is a setting aside state match for what will be an Army Corps study. The match requirements may well be higher, but this is to look at the upper Winooski River Basin and to try to kind of understand water and make amends if necessary or if allowed, and just to study the basin and look at it from a sustainability standpoint. And again, the study would be, I believe, either with or by the Army Corps. So,
Yes, sir, fine.
this is really, since I represent Plainfield and Marshfield and one other thing. Who is gonna tell us more about this?
DEC,
EDC, okay.
this was one of their top priority. I mean, you'll see, or one of them, you'll see that this is something they'd like. So yes, DEC would be happy to come in and talk to you.
And if I might,
Go ahead.
this is fantastic. Do you know if it's actual, we've been accepted as part of WORDA as a earmark for facilities?
Yeah, I
Not yet?
think that's,
Okay, so this is fantastic, much needed. We know after Tropical Storm Irene, we only looked at the section of Winooski around Waterbury. Much needed.
Yeah.
So I appreciate this support.
yeah, Secretary Moore was very happy
Yeah,
with this.
Representative Squirrel, you will, all right, I know we got 4 more lines. You're Commissioner, I'm gonna keep, you've got.
And some of them, the Healthy Homes Program, and you have funded that multiple times. It's had some ARPA funding, it's had some general funding, most recently in last year's budget. This is adding to that program. This is just providing predominantly, kind of wastewater and drinking water upgrades to low and middle and moderate income
Okay,
households.
and I believe more mobile homes.
So another 4 million, that their request was actually for more than that. But this is what we had.
Mhm.
The capital investment loan program, that's traveling in a separate bill. I think H708 is that?
This is brand new, so I don't want to hear more about
Okay,
that.
so that would be an ACCD, economic development. That's, I think, a pilot program that is predominantly aimed at small and medium-sized businesses in more rural areas.
Which bill do you think it is?
H708.
708?
I think it's 708.
Okay, thank you.
Don't quote me on that, but I'm
Sorry, I
sure.
should start looking it up.
I'm pretty sure we're gonna quote you.
The International Business Office renewal, so ACCD has and this is, I believe, contracted, but they have a presence in Montreal. And the idea is that the more we can kind of promote Vermont, the more business will be able to attain there. Something that Department of Economic Development is.
Commissioner, I'm thinking that there's a field trip needed in there to check it out.
Okay.
Spring.
You could arrange for the curling practice.
For the Montreal.
Um,
What did he say?
Curling.
Woody's gonna arrange a curling session this
I'm
week.
going up for a couple of days over. I could scope it out and make sure we have the right places to go for our field.
You'll be ready by the spring for the House appropriation.
You have to spend a lot of time on this budget item.
Yeah, 150,000.
Woody's our ringer.
Sure.
Okay, sorry to disrupt us, my fault.
We like to have.
I know, Commissioner, I'm sorry, because you've got
The
to.
last two are easy in that they exist. These are programs that HCD operates. They're one is for manufactured home improvement. And the other is our very popular VHIP program that we like to say anyway, is probably the most cost-effective way to get new housing online. So another, appropriation for that program. So that shows you how we're using our one-time. I would also note that there are some, what I would call good government, use of one-time, roughly 3.4 million of transfers that Hardy had already mentioned earlier to E911, fire prevention, NRB, and criminal records check. That's also uses of one-time, but they're set up as transfers. So we take that and that 54 million we invest to get up to the 59 or so that we're bringing there. And that was a kind of a whirlwind, as you're aware. The departments will be very anxious to come in and fill your minds with real facts.
Yep.
So,
And then we'll rearrange the box a million times over with your help.
so, and we look forward to coming back and going through the language document that is on your, again, there's some good stuff in here that you should be aware of.
It's all fabulous. Work we do.
I did want to address the question that was asked about the somewhat confusing C-section language, which restates and are there double counts? So what's going on there is, well, first I'll give you the history. What we're doing this year is we're actually proposing some changes to the governor's recommended budget adjustment act. And we did this last year as well. So in terms of, updating some numbers and changing some things. And last year we submitted language in the governor's recommended budget referring to the previously submitted budget adjustment act and referring to certain things we wanted to change within that document. We were reprimanded harshly by legislative counsel and informed that we couldn't refer to something
That's not there.
that is not there. So we've been educated to the fact that the proper way to submit language is we have to rewrite the entire section that was previously submitted in the Budget Adjustment Act and submit it as an entire new section, including the changes in the C-section language for the governor's recommended budget. I did try to provide the committee with a service of providing some yellow highlights. And the yellow highlights refer to the only things that are actually different than what was submitted in the Budget Adjustment Act.
That will be helpful, and I'm sure the Ledge Council does a similar service for us as well to make sure that we don't do things, and every now and then, something gets missed, and it's not always their fault. Speaking of that, and then there is something that I know in there that I had a conversation, this is the Essex situation that's in FY 25.
Yes.
Because of, and we have an FY 24 BAA, but the comparison piece that wasn't done to make that balance. I know that you put it in the FY 25. Entities are a little concerned because now it's hanging out there and they're concerned that we'll miss them. So we had a conversation to see if maybe in the Senate or something that we bring the Essex piece back into the BAA.
The courthouse.
Yes, so I believe what you'll find in the C-section of this document
Is
that we are rewriting the BAA recommendation to include that $300,000 in FY 24 that we inadvertently missed first time around.
So I think it would go a long way in their calmness if we actually had an amendment to actually put it, whether it's in here or in the Senate.
Yeah, it's in the C section, which.
Yeah, so we're gonna lift it
Oh, okay.
maybe and
Put it-
just, I'm telling you that, so
I mean, it's a use of money that,
just action. So I don't have to have you back in to testify. You want to do it. All right.
Certainly.
Oh,
So
Representative
just
Chai.
quickly on the reversions, you said you put in section C, all of the reversions that were in the budget as you submitted. However, we made changes to
That's
some of
right.
those reversions.
Yes.
So those are not incorporated into what you put in. So we have to go back through and look at all those reversions and see versus what we actually put in the budget.
That's
And this is the task that you're saying that Ledge Council stays up late at night and requires aspirin because of us. Thank you.
change what we put in, it'll be.
Well, don't change what we.
Just copy and paste.
It would be, can you just imagine if we could sit in the room well, you're building your budget, like how much more we would be. When it got, you know what I mean? Because if you could, you have
You'd
staff
love it,
here,
wouldn't you?
right? You have staff, can you imagine getting that term? Then any of that would be out. It would be so much easier.
Unfortunately, you all would have been working 12 to 14-hour days last Saturday and Sunday, so.
We just can't see you. Representative Dickinson.
Yeah, I just want to ask, I'm looking here at this language and under the reversions, I see an awful lot of things that were identical to what we had on. the
That's what he said.
That's what he's saying.
Yeah, so that's the stuff you want to change.
The new stuff, the new stuff is in yellow.
Yes, the new stuff, so the old stuff is.
But he was,
But then we
he
did
alleges,
versions in the.
he alleges that it's our fault.
Yeah, one of the ones that I
He
remember.
had to repeat everything.
And it'll
It's
be,
our obdurate sort of attention to
so.
rules, you know, it's just us, you know, in our
So-
anal behavior.
I'll cut to the chase that we'll probably change everything to the way we had it, so we'll just stop we don't have to worry about like trying to tag it up. We'll just make sure that everything is the way we wanted it and then see where, yeah.
Thank you, Madam Chair.
You're welcome, sir.
Run off.
Thank you.
Thanks,
Thank you all. And next time I'll grab some cake.
Coffee sometime,
You too.
yeah.
Shouldn't do that.
All right, thank you. Will you check with Aaron in time about coming back for language? Because we're gonna, I think, starting on Monday with HS. Yeah, sometime early next week, because then as we start to hear budgets, we want to know what. We're fine. Yeah. All right. Committee, all right, so it's 11 o'clock. We have, I have to get myself organized for all of us, get organized for caucus of the holes at 3. Between now and then, I know people have given me some really good things. What I'd love to do is to go through the BAA now that we've got an actual bill. I want to be able to put your names next to where you have the details so that I can maybe answer questions superficially on stuff. But I know who to point to that, and I want to make sure that I've got that recorded correctly. So if you could help me get to there between now and 3, that would be good. I'm going to go work now with JFO before I have a meeting at lunch. But between now and then, to get the updated documents, I need to go take a look at that and understand what we're going to hand out. And then, so what I want to do is be able to get that, have my lunch meeting, put on your desk, or however we get together. We don't need to get together, but at 1 o'clock, I want you to have the documents and take a look at them as well. Before we go to the floor, I'm gonna like off the cuff, Emily and Maria, what do you think of the idea of that we get back together at say 1:30? To have them walk through whatever the documents that you are that we're gonna bring out to the floor. I do not want the members here to be cold with that out there, okay? So 1:30 back here-ish. Okay, and then we go to the floor at 3. Life is happy. Okay,
Thank you for all your prep.
Yeah.
you're welcome.